Hello everyone, welcome back to the channel Homeopathy Remedy Marvels. So the topic of discussion, diabetes mellitus, is clinically of most importance because half the population of our country, India, is diabetic and the other half is in pre-diabetic stage. Looks like that because of the lifestyle and environment. So having an in-depth understanding of diabetes mellitus and how to manage it and what changes are required to really reverse it. Is it reversible? Can you manage it? Yes. So let's talk about it. So diabetes mellitus is not actually, it's not a single disease, right? It is a group of metabolic disorder. So multiple things are going on at the metabolic level of our body. But what there is a single phenotype is that patient will present with chronic raised glucose level in the blood. Now, in order to diagnose diabetes, as physicians, what parameters are considered? Of course, the symptoms of diabetes. Okay, when it comes to symptoms of diabetes, there is a triad which is considered, which is formed by polyuria, means multiple times urination, daytime as well as night. Polydipsia, the patient will be very, very thirsty throughout the day, and weight loss. Okay, polyphagia is also a symptom, but not part of the triad. Now, in sometimes in type 2 diabetes, often the patient comes with no such prominent symptoms. Okay. Another parameter is random blood sugar should be more than or equal to 200 milligram percent. Third, if we advise patient for fasting blood glucose level, it should be more than or equal to 126 mg percent. But we need to check it twice. Now, in case we go for oral glucose tolerance test and we check for plasma glucose, that should be again more than equal to 200 milligram percent. Another parameter which is done, HbA1c, in case if it is higher than 6.5%, then when all of these are presented, the patient can be diagnosed as a case of diabetes mellitus. Now, initially, the strongest indication is often hypertension, right? Now, different ranges are considered in order to see whether this case is pre-diabetic or into diabetes already. Now, let's see the normal values. For fasting blood glucose or fasting blood sugar, normally it should be under 100. But in pre-diabetes, it can go up to 125. And in diabetes, it is over 126. If we go for postprandial, means after 2 hours, taking about 75 grams of glucose, if we go for the blood sugar levels, it should be, normally it should be under 140. But in pre-diabetic state, it can be in the range of 140 to 199. And in diabetes, it is equal to over 200. Again, if you go for HbA1c, normally it should be under 5.7, but if it is ranging from 5.7 to 6.4, patient is pretty much pre-diabetic, and going above 6.5, that is diabetes. So these are the ranges that must be considered. Now, there is something called as elementary glycosuria. What do we mean by that? Usually, this is after any dietary change or after gastrectomy, or often in cases of hyperparathyroidism. Now, normally, gastric emptying can take about 2 hours. But in this condition, elementary glycosuria, it can come down to less than half an hour. So obviously the blood glucose levels will be raised. Now, HbA1c, something that we must understand is that this is actually a glucose molecule attached to a hemoglobin molecule. So this is glucose, this is hemoglobin. So this is basically glycated hemoglobin. Okay, it is a non-enzyme, and normal range, again, it should be less than 5.6%. And this is usually a single parameter done if you want to see on a long-term basis, right? Traditionally, fasting blood glucose is done, but it may fluctuate. So self-monitoring is often not advised. You must go for other parameters also, especially HbA1c, which can be done twice a year at least. But if it is not controlled, diabetes is fluctuating, then you can go for 4 times in the year. Now, diabetes is actually of 2 types, type 1 and type 2. So let us discuss the details of type 1 diabetes. Now, this is usually presented in young adults, less than 40 years, you can say. And the patient's weight, usually it is normal, or they may lose some weight. So they can be underweight also. Now, what happens in type 1 diabetes is that the body starts to produce auto-antibodies. Okay, and these auto-antibodies, they cause destruction of the beta cells of pancreas, because of which the beta cells are responsible for insulin production, which controls the glucose metabolism. Because of this, the antibodies eventually cause less insulin production. Okay, now sometimes in this condition can be associated with other autoimmune conditions. Okay, so you can see HLA, DR3 and DR4 can be raised in these conditions. Treatment is usually conventionally, patient is given external insulin. They can have genetic predisposition, but sometimes stress in the form of trigger can produce it as early as in children that we see nowadays. This also has stages. In stage 1 type 1 diabetes, sometimes fasting blood glucose levels are normal, but the symptoms are coming. Or stage 2, autoimmunity continues, and then patient present with dysglycemia. And when stage 3 arrives, that is where the classical hyperglycemia is seen, and then that we called as diabetes, overt diabetes. Okay, so the stage 1 is actually called as honeymoon phase of type 1, and the reason is that it lasts for 1 to 2 years, where usually symptoms are not there and the insulin is slightly reduced. Symptoms are less, or patient may have no symptoms at all. So this is called as honeymoon phase of type 1 diabetes. Now, type 2 diabetes, this is a kind of diabetes where the weight of the patient is generally on the higher side. Again, no autoantibodies are present in type 2, and ketosis, which is very common in type 1, is usually uncommon in type 2. Okay, but non-ketotic hyperosmolar coma can be presented. Okay, now non-ketotic hyperosmolar coma, this can be a case of our emergency. Family history is usually positive in type 2. Of course, insulin resistance is reduced, and initially the serum insulin level will be high, but then they will come down. Okay, now if we see the difference between type 1 and type 2 diabetes, Age group is generally, type 1 will be obviously less than 40 years, but in type 2 they are generally over 40 years of age. HLA will be positive, here there will be negative. Weight of the patient will be generally normal or can be less, but here the patient's weight is overweight. Family history can be positive, can be negative, but in this case usually it is positive. The time of development of type 1 diabetes is generally abrupt, but here it is a gradual process. Insulin in the form of treatment is required. Here in later stages that may be needed. Serum insulin, of course, will be very much reduced, and in this case this will be on the higher side. If we see the etiology or the cause, how it develops, generally it is an autoimmunity that is functioning. Sometimes after viral illnesses this can be triggered. In type 2 it is because of the insulin resistance being high. Okay, now there is a very important relation between body weight and insulin. If the body weight is more, the patient is overweight, the number of receptors, now what do I mean by that, number of receptors? Every beta cell of pancreas has a receptor here. What do we mean by that? This receptor is called as tyrosine receptor, which receives insulin. Tyrosine kinase receptor. Now if the weight is high, these receptors comparatively will be less. So what happens is something called down regulation starts. But when we advise the patient to reduce their weight, when body weight goes down, these receptors will be comparatively high, and then up regulation of insulin starts. So therefore it is very important in type 2 diabetes that the body weight has to be reduced. In all cases we tell the patient to reduce their weight. Sometimes it is certain theories say that there are thrifty genes in our body where the patient, because of these genes, they start to overeat, eventually landing in obesity and then having that insulin resistance and then having diabetes. But again, these are theories. Now coming to the homeopathic management of diabetes, there are many medicines that can be given. Constitutional treatment is definitely the most effective, but there are certain organopathic medicines that are given along with the main remedies, and this can be taken to maintain the blood glucose level. So some of them are Syzygium jambolinum, Uranium nitricum, Abroma augusta, acid phos, acetic acid, lac defloratum, gymnema, and grindelia. So these are some list of remedies. Of course there are many more remedies. I hope this information is useful and you will keep adding your experience to it and be able to manage the case of diabetes. Subscribe this channel. I'm coming up with more such clinical conditions and their homeopathic therapeutics. Thank you so much.